Namaste. I am Dr. Shama Kaji from Faculty of Physiotherapy and Diagnostics. And today in this video, we are going to talk about scars. The scars form as a part of healing process following damage to skin as body lays down collagen fibers. If epithelial layers alone is damaged, there is often little or no scarring as it heals by regeneration. If dermal layer is damaged, healing is by repair. Scar revision, plastic surgery performed to improve condition, appearance of scar anywhere on body. Scar evolution and revision technique are chief among most important skills in facial plastic and reconstruction surgeons. We talk about anatomy of the skin. We found there different type of anatomy in young, aging, and there are three types of the phases we found in the healing of scars. First, inflammatory phase, where vasodilation and cellular response may take place. In the proliferative phase, we found reepithelialization, fibroplasia, collagen synthesis, and wound contraction. And in the third stage, which is maturation or remodeling phase, find formation of the scars. The maturation phase is comes in between 3 weeks to 1 year. The proliferative phase may come in between to 1 week to 3 weeks. Wound healing. The cellular activity may involve scar maturation, collagen fibril, cross-linking, remodeling, endothelium, epithelium, collagen deposition, fibroblasticity, proliferation, lymphocytosis, macrophages, neutrophils, inflammation, fibrin, platelets, and hemostasis. The abnormal wound healing. Abnormal overhealing wound important to note with scar division includes keloid formation, hypertrophic scars. There are different types of scar classification we found as mature scar, superficial muscular scar, immature scar, ice pack scar, linear hypertrophic scar, rolling scar, widespread hypertrophic scar, boxcar scar, minor keloid, major keloid, and contracture. Mature scars are light in color and flat. Immature scars are red, sometimes itchy or painful, and slightly elevated scars in the process of remodeling. Many of these will mature normally over time and become flat. Linear hypertrophic or surgical scars. Rare child, sometimes itchy scar confined to the border of original surgical lesion occurring within weeks following surgery and can regress of its own. Widespread hypertrophy, or you can say the example as in burn. Widespread red, dry, sometimes itchy scar that remains within the borders of the burn injury. Minor keloid, focal rise, itching scar extending over normal tissue and may develop up to 1 year after injury and does not regress on its own. Major keloid, large, raised 0.5 centimeter scar, possibly painful, pruritic, extending over normal tissue, often resulting from minor trauma and can continue to spread over years. Contractures, restrict movement due to skin and underlying tissue that pulls together during healing and can occur when there is a large amount of tissue loss or where the wound crosses a joint. Superficial, the superficial tissue, or we can say the superficial scar, where the tissue of superficials are involved, can be said as superficial muscular scar, occur only in epidermis and superficial dermis are involved, appears as erythematous pigmented macules, eye speck scar, which is cone shaped, narrow, deep, sharply marginated epithelial tracts extend vertically to deep dermis or subcutaneous tissue. Rolling scars. Wavy scars or rolling scars occurs from dermal threading of otherwise relative normal appearing skin. Abnormal fibrous anchoring of dermis to subcutaneous lead to superficial shadowing or rolling or appearance of the underlying skin. Poxcar scar, या फिर chickenpox scar, like round to oval depressions with sharply vertical edges, similar to what viscera scar, are clinically wider at the surface than iceberg scars and do taper to a point of the base. You can find as the acne scar, which is a subtype where we find relaxed skin tension lines, lines that follow the fural from when skin is relaxed. Forces that cause RSTLs are inherent in the skin itself and the underlying collagen matrix. Com- correspond to directional pull and that exists in relaxed skin, pull largely determined by the protrusion of underlying bone and tissue bulk and frequently run perpendicular to the underlying fascia musculature, not visible feature of the skin, unlike wrinkles, can be found by punching the skin and observing the furrows and ridges that are formed. The lines of maximum extensibility are perpendicular to RSTLs. If we talk about the facial subunits, where the different differentiation may found, the scars to be consideration are longer than 20 mm, wider than 1 2 mm, as we can see that there are different kind of scars which involve dermis, epidermis area. Hope you understand it well. If you have any queries related to this video, ask me in comment section. Namaste. This video is powered by digital version of 2.0 Jyoti Vidyapeeth Women's University.